All right, welcome to episode 49, Protect Patient from Injury. So this is not just preventing falls. While that probably is the biggest injury that we're concerned about maybe, or that we're actively thinking about is preventing falls, there's a lot of other injuries that could occur. We need to make sure that as the nurse we're preventing that. So we want to make sure that when they're up, we're doing our fall prevention care plans, educating patients appropriately about that, but we're also protecting them from injury, maybe, making sure the food that they're eating is the appropriate temperature, that they're not using too hot or too cold of liquids, that if there is a weather concern, like a tornado or hurricane, lightning, that kinds of stuff, electrical hazards, we're preventing or we're protecting them from that. So if we have to relocate the patient because of tornado warning, or if we're noticing, the wiring on their bed plugging into the wall is frayed or something like that, we have to make sure that we're protecting them from that. We're also protecting them from any unsafe behavior from themselves, from other patients or visitors. If you have their roommate is being unsafe, or if they're a harm to themselves, or if there's a visitor, calling security when appropriate. Got to make sure that we are addressing those things and protecting the patient. It is our duty as a nurse to make sure our patient is safe. So do whatever we can to protect them from injury. This also includes patients that have attempted suicide, or maybe have mental health concerns. Protecting them from injury includes protecting them from injury from themselves. So that may mean following whatever the suicide precautions are. So removing anything from the room that the patient could potentially use to harm themselves. So when they're getting food delivered, they're not getting a knife. They're not getting real silverware. They're getting plastic utensils. They have someone, a sitter, someone observing them at all times. Some things like that. So we, as the nurse, must protect our patient from injury. And that concludes episode 49.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to NRSNG.com/NCLEX Prep. That's NRSNG.com/NCLEX Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.